The 2013-2014 school year will bring several changes to the health insurance options offered to the employees of Tyler ISD. The Affordable Care Act requires individuals to maintain minimal health insurance coverage for themselves and their dependents. Unless an individual is exempt, the individual will have to pay a penalty for every month the individual fails to maintain health insurance coverage. This requirement takes effect January 1st, 2014. There is no penalty for being without health insurance if one of the following apply. You're part of a religion opposed to acceptance of benefits from a health insurance policy. You are an undocumented immigrant. You are incarcerated. You are a member of an Indian tribe. Your family income is below the threshold for filing a tax return, which is $10,000 for an individual or $20,000 for a family in the year 2013. You have to pay more than 8% of your income for health insurance, after taking into account any employer contributions or tax credits. The requirement to have health insurance is satisfied and no penalty is assessed if you were insured for the whole year through any combination of the following: Medicare, Medicaid or the Children's Health Insurance Program, TRICARE for service members, retirees, and their families, the Veterans Health Program, a plan offered by an employer, insurance bought on your own that is at least at the bronze level, a grandfathered health plan in existence before the health reform law was enacted. Under the Affordable Care Act, the penalty for being without health insurance is as follows. In the year 2014, the penalty is $95 per adult and $47.50 per child, up to $285 for a family, or 1% of family income, whichever is greater. In the year 2015, the penalty is $325 per adult and $162.50 per child, up to $975 for a family, or 2% of family income, whichever is greater. And in the year 2016 and beyond, the penalty is $695 per adult and $347.50 per child, up to $2,085 for a family, or 2.5% of family income, whichever is greater. After 2016, the penalty amounts are increased annually by the cost of living. The income is defined as total income in excess of filing threshold, which is $10,000 for an individual and $20,000 for a family in the year 2013. The penalty is prorated by the number of months without coverage, though there is no penalty for a single gap in coverage of less than 3 months in a year. Tyler ISD will provide an annual open enrollment period in September 2013, where eligible employees and their eligible dependents will be able to elect health care coverage for the upcoming health plan year, which is from October 1st, 2013 through September 30th, 2014. During this open enrollment period, covered employees and their eligible dependents will be able to make their health care coverage benefit decisions based on the particular plan coverage that is right for them. If eligible employees do not elect coverage during this period, they will not be able to enroll for coverage in January 2014, when all individuals are required to have health care coverage under the Affordable Care Act. If eligible Tyler ISD employees do not enroll during the September open enrollment period, they may be subject to a penalty unless they obtain minimal essential coverage by January 1st, 2014 through an insurance broker or entity such as the Federal Healthcare Insurance Exchange. In an effort to have affordable health care options for all employees that provide quality health care service, there will be changes starting October 1st, 2013. Tyler ISD is discontinuing the Inpatient Hospital Benefit Plan, IHB, and offering 3 health care insurance options. They are TISD Plan A, TISD Plan B, and TISD HD, or high deductible. The employee premium rates for Tyler ISD medical benefit plans A and B have remained the same for the past 8 years. For the upcoming insurance year, there is a premium increase for medical benefit plans A and B, but no change in benefits. Even with the rate increase, the premium rates for medical plans A and B are significantly lower than the comparable TRS active care plans, which are used by approximately 90% of school districts across the state. Plan A provides the most comprehensive coverage, contains the lowest deductibles, coinsurance, and copays of the 3 plans offered, and has the highest employee premiums. Plan B provides comprehensive benefits with moderate deductibles, coinsurance, and copays, and with moderate employee premiums. The HD plan provides comprehensive benefits after a high deductible is met and has the lowest employee premiums of the 3 plans. This plan covers preventive care at 100% if services are rendered by an in-network PPO provider. The HD plan will be compatible with a health savings account, so individuals who select the HD plan could elect to set up a health savings account if they so choose. In the past, Tyler ISD has not offered a high deductible medical benefit plan to its employees. The HD plan Tyler ISD is offering employees is deemed affordable under the Health Care Act. All 3 plans meet the Affordable Care Act minimum essential coverage requirement. Please begin to give careful consideration to your plan of action regarding health care coverage for you and your eligible dependents. Consult your income tax professional if you have questions regarding the penalty for being without health insurance. For detailed information about each plan, visit tylerisd.org, select the Employment tab, and select Insurance Information from the drop-down menu. If you have specific questions about the healthcare options offered by Tyler ISD, call the TISD Benefit Support Specialist at 903-262-1082. Thank you.
Today I want to go over just briefly the delivery of health insurance policies. Health insurance policies are on the whole very complicated, and to avoid any sort of problems it's very important that the agent sit down with the person who's applying for the health insurance and go over it with them. So the agent is responsible to ensure that the policy owner understands at least the fundamental aspects of the contract. Due to the complicated nature, you don't want anything having problems on the back end. So when health insurance is going to be provided, the policy is going to be there, it's going to be delivered, it's very important that prior to the initiation of the contract that the agent sit down and at least explain the fundamentals, the basics, the main points of the aspects of the contract. Now, there are 3 things that are required after this basic responsibility of ensuring the policy owner understands the fundamentals of the contract. The first is policy review. This is very similar, but this is a formal review prior to them signing and it being initiated. Go over the major information in the policy and then provide a written policy summary. So there's going to be a verbal going over of the major things in the contract, and then you're going to hand them or get to them a policy summary. So there's going to be both a verbal and a written way of going over the major information in the policy. 2, you need to get from the person who is initiating the policy a statement of good health. This is basically them saying, I affirm that from the time I first submitted my application for health insurance till now, where we're going to initiate the contract for health insurance, my health has not changed dramatically for the worse. I am still in good health. My health is the same from when I applied to now that we're initiating it, because there is a span of time there, sometimes greater, sometimes lesser. But it's important from the insurance company standpoint that the agent get some sort of signed statement saying that my health is still good. It has not changed for the worse in the intervening period between when the application was first sent in and now that it's about to be initiated. And then third, the agent needs to get delivery receipt confirmation. So here the agent must verify that the insurance policy is in the hands of the owner, that they have received it. As far as the insurance company is concerned, as soon as they mail it off, they're done, they're good. But the agent is required then to come back and verify, did you receive it? Is everything in order? So there's a little bit there between the agent and the company. But basically in a health insurance policy delivery, remember, because of the complicated nature of it, it's important that the agent sit down as the responsible person there and ensure that the policy owner understands at least the fundamentals of the contract. So there's going to be a formal policy review where verbally you go over the major information, and then you also provide a written policy summary. Second, get from the person who is buying the health coverage a statement of good health, that they are affirming that their health has not changed in the time interval between when they applied and when you're now initiating the contract. And then third, the agent must verify that the contract was received and that everything is in order. Like I said, this is just a basic overview of this. If you'd like to study further about this and related matters, underneath this video you'll see a link. If you'll click on it, it'll take you to that website where you can get that information. And while you're there on that website, there should be a link to an ebook that's ready for immediate download.